Hi, everyone. Thank you for having me join you all this afternoon or evening, I guess. It's really amazing to see all of you come together and participate in this training and learn so much more about mental health. And it's a really, as you all know, a really important topic. Gurpreet had asked me to share a bit about Asra, which is the project that we started, I think about a year and a half ago now. I want to share with you guys what I did and how I started and what the motivations behind it was. So as Gurpreet's put up on the screen, so it's called Asra, the Punjabi Alcohol Resource. The way this project started was, I personally had someone in my life who needed help with alcohol use problems, and they were Punjabi speaking, and I didn't know where to go, where to find help, where to find resources. And I'm also in medical school, so I was very closely linked to the healthcare field as well. So I was like, I'm very educated, I have access to resources, and yet I still don't know where to go or find help for someone that needs it. So I thought that was really a big sign that something is lacking in our community. And I knew, this is not a small problem. There are multiple people who know someone who struggles with alcohol, especially in the Punjabi community. So basically that sparked the idea, let's create a resource where people can come, and it's Punjabi specific, that tells people about alcohol. It has some things like harm reduction. So basically explains what alcohol use is and how it becomes, a problem versus a regular social drinking. Explains how you can get treatments, how you can help people. And then it has a whole list of resources based on counseling groups, Punjabi counselors, rehab centers, treatment centers within the Lower Mainland. So we put, basically when we started this project, it was an idea that I had, and I spoke to a doctor who worked in the area, and then we started working. But as I started working, as I think Pete just mentioned, it's so important to have a team that works with you, because it's really almost impossible to do the work on your own, and it becomes very overwhelming. So I actually partnered with Samha and the youth ambassadors from I think they were the first cohort, who really helped this project come to life. So they, we did all the research together. We surveyed all of the Lower Mainland, and once we gathered all this information, we created this website. So it really was, as I mentioned, a pretty big team effort, and without the team, I know I wouldn't have been able to put everything together. So in summary, what Asra is, it's basically a starting place for Punjabi families to teach them how to navigate alcohol use disorder. What we found actually was, before we even created the resource, we actually did a community needs survey, which was really enlightening. So we created an online survey. We distributed it through different social media, so through Instagram, through Facebook, large networks with a lot of Punjabi people who followed. And we asked questions like, do you know someone who has a problem with drinking? Did you ever get help for that person? And if you answered no, what were the biggest barriers to you getting help for them? And if I recall correctly, I think the biggest barriers was, one, with stigma. People didn't want anyone to know that somebody in their family was struggling. They found it really hard to talk about that with people outside of their own family. Two was a lack of culturally aware resources. And I think third was Punjabi speaking resources as well. So we then, saw what the biggest problem was, and we asked people how they would like to have resources presented to them, what types of resources people were looking for. And kind of bringing all that together is how Asra came to life. So not only was it an idea, but we also were informed by the community about what people would actually use. I don't want to ramble on forever, but the point really being here that, when, like Pete was saying, when you find something you're passionate about, or you find something that you see there is a lack of this resource, there's a lack of help for this specific problem, and it can be for your community, it could be for some, generally, that's kind of the best place to start, because you have a passion for it. And if you have a passion for something, it's a lot easier to do that work. And once you have an idea, try and build this team that will help you reach your goals. So we started this a year and a half ago. Today, it's really amazing. Not only are people in BC working on it, we've connected with someone. So there's another co-leader now who is doing her master's work in this topic in Ontario and Winnipeg. So now we're kind of working all across the country, and we've connected through Zoom from people in the States, from people in Toronto, from people in Alberta, from people here. So it's really amazing to have these conversations with people all around the country. And today, like one of our focuses for Asra is, now that we have this website, we want to create like community conversations. So we have had a few different workshops via Zoom where we've had like 20 people attend and have different discussions on the alcohol problem in the Punjabi community. We are doing like different social media outreach. We're doing a new survey to create a support group. So there's a lot of things happening, but it all started with like one kind of idea that this is a problem that needs to be addressed.